Hello and welcome to the next episode of ASAP Conversations. So those of you who may have been listening to the earlier conversations, you know that this is a series of conversations we've been having with our members, partners and other stakeholders in order to create a sense of solidarity in the universality of the problem that we are all facing, and also to bring to global forums and politics the testimonies, stories and issues that are faced by people from our region, which are very often either underrepresented or missing altogether from the context. So we have with us today a very special guest. We have Barbara Klugman, who's joining us here from South Africa. She has been associated with the Asia Safe Abortion Partnership for a while now. She has helped us through our strategic planning exercises as well as a monitoring and evaluation learning process. And we do see her as one of our really close partners and supporters. And we're delighted that she has agreed to have a conversation with us here today. So Barbara, I would request you to just introduce yourself briefly to the audience.
Hi, Suchitra. So lovely to talk to you today across all of the oceans. Well, I never know quite how to introduce myself. The last 10 or so years, I've been doing strategy support for social justice funders and for networks like yourselves and NGOs, helping people articulate their strategies, their theory of change, as the evaluators and the funders call it. And also thinking about how are we learning and what are the most viable ways of doing our learning when we're not big organizations with tons of money to be gathering data and so on. So that's a lot of what I do. My professional background, if you like, is in sexual and reproductive health and rights. I worked in that field for a long time. For just over 10 years, I ran something called the Women's Health Project at Wits University in Johannesburg. At that moment when apartheid was coming to an end and we knew that we could influence laws and policies of the new government, which we certainly did with many allies. And then I went and worked at the Ford Foundation, funding their efforts, especially to get groups in what the Americans call the Global South to be able to have a stronger voice and more influence at the international level, and also doing work on sexuality research. And it was after that that I kind of morphed into this freelance role, which I have to say I quite enjoy. It feels very age appropriate to be supporting a next generation to do their thing.
That's absolutely wonderful. And I must say you've definitely been able to support us, get our head on straight and analyze the advocacy landscape and our own theory of change. But for those in the audience who are not aware of what these words mean, I was wondering if you could elaborate a little bit on the whole concept of, measuring social justice advocacy and how theory of change is part of that process.
So, I mean, one should hate jargon. It's really irritating. At the same time, sometimes it's useful. And I think in order to gain power, it's important that groups that do fundraise are familiar with the discourse of the funding world, the evaluation world, and so on. But actually, it's quite a nice term. If you think about what it is that makes you think, if we do this, we'll influence that. It's a kind of a theory. What you're doing is you're reading the environment, you're reading the context, you're understanding who supports your issue, who's against your issue, why that is, what's going on in the context. And out of that, you're thinking, well, we think that if we did these activities, we could influence those people who in turn could influence maybe the public discourse, the media, how people talk about the issues, or maybe they can influence local service providers or the municipal government or the national government to do things differently. And so it's a theory. It's your best guess in your circumstance. And I think in general, this is how activists work without giving it a name. They read the environment, they work out what strategies to try out, and then as they implement them, they're asking themselves, is this working? Is this working the way we hoped it would work or not? If it's not, what should we change? How should we shift our strategies? So the idea of a theory of change is, in a way, making more concrete for a whole organization or a whole network what your assumptions are. If you're one or two people, you work together, you chat every day, these days over Zoom, not together in a room, then you probably need to have this formalized less than when you're, for example, like Asia Safe Abortion Partnership, you've got groups working together from all over the region. And so you have to have a way to talk together to make sure that you're all on the same page. And so part of the reason for a theory of change is to collectively articulate what is the space we're in, or in the case of Asia, what are the many different spaces we're in. In each of those spaces, how do we think we can achieve our objective, and to make sure that all of you are on the same page about that objective. So we're all trying to increase women's access to abortion. We want it to be safe. We want them to have that access with dignity, not being treated like criminals. And so the conversation, in a way, is the most important part. Then you can write it down. And it's useful to have it written down, because as you recruit new members, you're able to say, this is our best thinking. And the idea of, what formally is called monitoring and evaluation and learning, having a system like that, if you get rid of the language, is about stopping every now and again and saying, what have we seen? What evidence do we have out there that what we've been doing has been working? If it hasn't been working, is it because kind of the forces against us are so powerful, we've just got to keep battering along? Or is it because actually we've chosen the wrong target? Like maybe we're trying to decriminalize something, sex work, abortion, whatever, in a context where those in power will not decriminalize. Should we be trying something else? Should we be going for a harm reduction strategy? Should we be doing something else? And so the value of the theory of change is not that it should be set in stone, but that you would stop, depending on who you are. It could be once a month, could be after a big event like a conference or a training, could be every 6 months or once a year, and look and say, okay, have we had the influence we hoped to have? What does that look like? Who's changed? In what way have they changed? And if we haven't, does that mean we need to change strategies? And so that's the kind of, so the monitoring is, if we just want to unpack the language, is just trying to keep a proper record of what we've done, who we've done it with, and how well we did it. So if we did training, by the end of that training, did people have the new knowledge that we'd hoped, or the shift in mindset and attitudes? Could they use it? And then the evaluation piece, did that take us where we wanted to go? So did any of those people actually use it? Did they do anything differently when they went home? What does that look like? The learning, what do we do with this? Do we change our strategies? That's my quick piece on the jargon.
Thank you so much. No, and as you know, I mean, we've been working together on this for a while. Is that, of course, there are certain limitations, even with this really pared down, very, daily functioning kind of a monitoring and evaluation learning system, because very often the impact of what you're doing isn't very easy to measure or access in terms of feedback. But I think it's been something we've integrated within the work we do, and it's really worked for us quite well. Because I think the way we have changed our thinking now is that we are looking at what would be the evaluation questions at the time of planning the program itself.
Yeah.
So that it gives a very much a sharper focus to say that we are doing this because we want to be able to answer those questions at the end, rather than just saying, oh my goodness, the whole world needs to be a better place, we need to train everyone and we need to talk to everybody. So I think that has really helped give us a sharper focus. But that takes me to my next question now. In this current situation with the COVID pandemic, how do you see things shifting or changing for smaller NGOs, or NGOs who are working only on advocacy, which even at the best of times is difficult to measure, requires a long-term investment and real capacity to, I would say, be flexible to changing political and social landscapes. So with your sense of the, the groups you're already in contact with, how do you see this changing either now or in the post-pandemic world? What do you think are things we need to do? What would build our resilience to be able to cope with the situation after this?
Gosh, really big questions. The one thing that's clear is a lot of groups have shifted their advocacy directly to the COVID question.
Right.
Because in some way, the way that governments are dealing with COVID has made even more visible the inequities, even more visible the problems in relation to access to sexual and reproductive health services, even more visible the discrimination against people, even in their homes, the gender-based violence, the exclusion of all sorts of groups of people from recognition and from services. And so I suppose one of the interesting questions is, can some things be won in this period
Yes.
that could hold over to later on? So, for example, I was reading today a call by a whole lot of NGOs that work on reproductive health, sexual health, transgender NGOs, and sex worker organizations. And they were calling on the government to recognize that what constitutes home for many sex workers and transgender people who've been thrown out of their homes is not any kind of a traditional home. People may be living in groups that work for them, but that they're also exceptionally vulnerable, that the police will manhandle, if I can use that word, sex workers just because they're on the street. But what's interesting about the call is that part of the call is for proper shelters. And they make the point that that's a call they've been making for years. But what we see in some parts of the world is that government is more likely to spring into action in this period, because this idea that you have to be locked down and safe, or the whole country is going to die, is mobilizing some action. And so, that makes me wonder, might they be more responsive? We've certainly seen our governments doing things like making sure communities that don't have potable water suddenly have water. I heard on the radio yesterday they're preparing for our schools to open, and I heard a politician saying it's absolutely essential that all schools have water for hygiene. And I'm listening to this and I'm thinking, and it wasn't essential before?
Absolutely.
And it was fine for girls to be menstruating with no access to water at the school. And it was fine for kids not to be able to wash their hands. But never mind. If through this, they can demonstrate the ability for rapid action, then that will give advocacy groups something to work on and build on. The other thing that I think is interesting, I don't know that it applies, in every context at all, but there does seem to be more spaces for groups to ally with groups with a broader range of shared interests to make these calls. That in a way, the situation is so egregious, so terrible, that small NGOs at a time like this may well be able to find other groups who usually, don't care about reproductive health or about abortion, but are worrying, for example, that access to health services for other issues in general is not happening. For example, in some countries, immunization isn't happening properly. The whole question of the supply chain is worrisome for everybody, so one can hook on the question of supplies for medical abortion or supplies of contraception to those groups worrying about what's happening to the health system overall. So I think that's one strategy, is to really look for allies who may not be your normal allies, but are interested in similar issues. The other thing I found interesting, but I couldn't say is a trend in any way, but there are some governments in some places that seem where at least individual people in government want to show that they care. So I heard an interesting example, for example, in England, a young women's network who's organizing monthly webinars and have found that policymakers are willing to come onto their webinars where the young women can ask them questions. Oh, that's interesting. So, I think there are some things to think about in this heightened, fearsome situation, that maybe one can access politicians despite that you can't walk into their door.
Yeah, you're
those are some of the things I've heard.
You're absolutely right. In fact, as you said, using this pandemic and the way it has magnified the structural inequalities, using that as a window of opportunity is something we are hearing from some of our partners. In fact, just this morning, I was in conversation with some of our partners from New Zealand, who said they managed to push through the use of telemedicine for medical abortion pills because of the COVID pandemic, which, there wouldn't have been political will for otherwise. Yeah. So I think what you're saying is absolutely right. Using this, and it's bizarre that people would imagine. I think what has happened now is the middle classes, or people who haven't usually faced barriers, are now facing the barriers, and therefore recognizing what it feels like when you can't just get up from your home and go and get whatever you want. Because one of the conversations we had with a group of women who work for sex workers, they said social stigma, social isolation has always been there for this group. It's just now that the rest of the population is seeing it. So
Yes.
suddenly you're all about removing the stigma and, the social isolation becoming an issue. She said, we've been suffering this our entire lives. So I think that is, as you said quite rightly, building cross-movement alliances would be probably very opportunistic at this point in time. Yes.
And the other thing maybe is I haven't been following what's happening in the Asia context, but it is interesting to me that the mainstream, if you like, is naming our issues. So, for example, I was looking at a guideline for African states on promoting sexual and reproductive health. And also there's a call to the United Nations signed by a range of African governments and some governments in Europe around sexual and reproductive health. And they talk about the commodities problem. They talk about the likely increase in unsafe abortions. They talk about the likely increase in gender-based violence. So in a way, our issues have become mainstream. Yeah. And so again, I think if one can reference those things, that might help with legitimacy, even if a small, a sex worker organization may not be seen to be legitimate, but there are these bigger forces that are naming these issues, and one could make reference to those things.
Yeah, you're absolutely right. In fact, issues like, for example, menstrual hygiene products being included in essential products, or abortion being included as part of the essential services package. I think you're absolutely right. We're seeing more and more conversations around that. In terms of the work that we do, of course, requires funding support, particularly advocacy work, which, as you know, is a long-term investment. What do you think is likely to be happening in the donor universe at present, where there may be a consideration of prioritizing service delivery, because that would clearly be something very, very critical during and after the pandemic? And how would that affect the work being done for advocacy?
Well, look, the one thing is that there are funders whose focus is not service delivery, and until now have been supporting our kind of work. And that's not going to change. Although what I am seeing is that many funders have said to their grantees, what do you need to do? We will support you to do what you need to do. And so because of that, there are, for example, advocacy groups that are now trying to get food to their constituents. Absolutely. And so, yes, that is happening. One of my hopes is that the shift we're seeing, as some funders recognize that they have to say to their grantees, we realize that you won't deliver on what you promised. What is it you're trying to do? Tell us what you've done there. Tell us how well it's gone. Maybe this is an unintended and experience for some funders, inflexible funding, which is what you need to do advocacy. So I think that will be interesting. Rethink their theory of change and do things differently. And then to report on that and to be able to say, we made common cause with these groups. We'd never allied with them before. We put out these calls. We got a response from this group that hadn't happened before. So I think that in a way to use that greater flexibility responsibly, I do think that a little bit more money is going to come the way of women's rights groups precisely in order to advocate. And that groups on the ground should look around for the funders who do rapid grant making for urgent contexts, because I think there will be money there that groups could access in order to push this very agenda that we're talking about.
Absolutely. I think you've made some very, very valid points. And we've also been considering what the new normal is going to look like, But there are no timeframes in mind right now. And now we are hearing messages which say we're never going to be able to defeat COVID in that sense, but we just have to learn how to live with it. So I think the environment, both for the NGOs, the civil society, as well as the donors, to work together as a kind of a partnership, with greater flexibility. And of course, always recognizing that advocacy is critical. Because if we hadn't been doing advocacy for the last 10, 20 years, the issues, as you said, which got picked up in the mainstream may never have been visible enough for the mainstream to even pick up. So I think there is a lot of things we're going to have to rejig as we move towards the new normal. Is there anything in closing that you want to just remark on? Yes.
It's just one more thing. I think one of the things that has come out of the feminist movement globally has been the question of attention to wellness and well-being, and that activists themselves need to give attention one of my observations in this period is that it's, I can't imagine how it is for people whose lives every day are hard. What's interesting to me is that even people who have a secure home, who know what they're going to eat next week, are finding it really hard. And I think that it is important for advocacy organizations to recognize that and to think about the way staff members engage each other, to think about how to not behave as if it's business as usual. You know, recognize people are at home, they're trying to look after their kids even while they're trying to do their activism. They're desperately anxious for their granny who's in the highly vulnerable group and so on. And so I think that the whole issue of wellness and organizational wellness, that now is a time to think about that and think about one's practices and about sort of how in the way that networks and organizations interact among staff and with their broader constituency, they do give time to talking about how are we and are we okay and how are we managing, and that is a legitimate part of the view on that thought.
Absolutely. I think I'm going to close on that thought, because those of us who are working in this field need to also take care of ourselves. And I think that's also a really important message to go home with. So thank you very much, Barbara, for your time and your thoughts. And we will be in touch, and do take care and stay well. And we'll share the recording with you once it's up. Yeah. Thank you so much.
Thank you, and hello to all of the ASAP folks that I haven't seen for a good while. I hope you're all looking after yourselves.
Thank you so much. Bye-bye.